Hi, Dr. Wright here. Just want to go over some of the basics with auto injuries and if you have been rear-ended and the whiplash scenario. And so one of the things that will happen in a whiplash scenario when you've been hit from behind, usually a lot of times they're about 15-mile-an-hour impact, but at that impact your neck and the back of your neck will suffer almost 10 G's of force that will be applied to the spinal column itself in the neck. And just for example, at 6 G's of force, an Air Force pilot will black out at that point. And if you are having about 5 G's of force, you have a 50% of having a concussion. And what will happen at that point of the accident, of impact, the neck, this is the back of the neck and this is the occiput. The back of the neck and occiput will hit the back of the headrest, okay? Right here like this, and it will bounce off and go forward, and then the whipping forces will be applied as it goes forward and then recoils and it gets hit again back into the headrest. Sometimes that the body will try to inhibit that from happening, and that is also where more injury will occur if the body tries to stop that from hitting the back of the head. But nonetheless, what will happen also in that scenario too of the neck is that you'll have a strain within the neck, spraining of the ligamentous tissue, and each one of these joints will occur, especially at the back of the neck, the back of the head, as the head attaches to the back of the spinal column, and then all the muscles will be strained, and that also compounds the injuries that are occurring within the neck. And that is one of the reasons why it's so important to seek medical care right after an accident and be evaluated, possibly getting x-rays and maybe even a CT if those forces were enough to warrant that CT and possible head concussion if you're exhibiting those symptoms. So anyways, very important to get checked out, and then definitely be coming over to a chiropractic office like us where we can treat you and get you back to normal. And that is our goal, is to get the pain out and be able to get that range of motion back and where you're feeling back 100% whole. That's our job, and that's what we do. Anyways, hope we'll see you on the next time. Have a wonderful one, and we'll go from there. Thanks so much. Goodbye.